I think in the setting of myeloma, the other thing that's interesting is that we know there still may be a role for allogeneic transplant. The long-term follow-up of the randomized trial of tandem auto versus auto and reduced intensity conditioning allo initially failed to show a benefit in progression-free survival and overall survival for standard risk disease. In a post hoc unplanned analysis, we did a long-term follow-up, and the relapse rates of patients with who received the allogeneic transplant seemed to be significantly less in the higher risk patients. And I think, as also reported by the Spanish investigators and the European investigators, survival after relapse was better for allogeneic recipients than autologous recipients. And what suggests that, patients with a normal immune system derived from the donor that never had myeloma might actually be more effective in slowing down the disease. I think, in the context, what will the future will bring? We're all excited about these new CAR T cells and new immunotherapies, the bispecific antibodies, the other monoclonal antibodies arising in the field. We think all these are potential strategies that can be used to prevent relapse. I think to finish, one of the biggest challenges is that there still is a significant access issue to cellular therapies, particularly for minorities or for patients who are economically disadvantaged. We see that in the United States when only 30% of people who could potentially qualify for an autologous transplant for myeloma actually get transplanted. Those numbers are even smaller for allogeneic transplants. So I think as a society we need to find ways that we can find or facilitate access to some of these therapies that not only change the natural course of the disease, but many of them can cure patients. I think, as the European Society of Hematology, explored in this age of COVID, how we continue to collaborate and to share medical information will be essential to continue the current momentum. I think we've all were impressed by ESH's virtual meeting, although at 4:00 in the morning U.S. time, it was hard for me to participate. So I think those type of issues will have to be addressed. The ASCO meeting was all virtual and was actually also very well attended and very well organized. So in summary, I'm going to say that there is a lot going on in the field of transplant, focusing on 1, reducing toxicities, 2, increasing access, and 3, reduction of the risk of relapse post-transplant.